Welcome to Off Script. Tune in every week to hear the stories of and insights from NPs. We're your hosts, Maxine and Danielle, two technologists who are passionate about the future of patient care.
Our guest today is Dr. V, the founder of the Clinician Life and Nurse Rep. The Clinician Life provides customized resumes and career management, while Nurse Rep helps clinicians organize, track, and store their credentials so they never miss a deadline. In the clinical world, Dr. V has experience in oncology as an APRN manager and most recently in the diabetes and endocrinology space. In today's conversation, we discuss Dr. V's career path, her experience managing clinical teams, and her evolution into entrepreneurship. Dr. V, thank you so much for joining us. Could you please give us your own brief intro?
Yeah, thank you so much for having me. I'm very excited to be here. So, I am a nurse practitioner and also the owner of the Clinician Life. Our mission is really to help nurses and nurse practitioners just advance their careers and provide resources in any way that we can. I still work clinically as a nurse practitioner in endocrinology, and I'm really excited to be here today.
Well, we're so excited to have you and really excited to dive into your experience both in the clinical world and the business world. We'd like to start by asking you some questions about your clinical career path because that has so clearly informed a lot of your non clinical work as well. So, to start, what was your first job as a nurse practitioner?
So I started in primary care, although all of my experience was in oncology. So it was a little bit of a different path that I was taking just because it was the best opportunity available once I graduated. I learned a lot, and it was in a value based healthcare organization. And so I learned all about what that looks like on the inside, and really, as a new grad nurse practitioner, kind of what the new things that I didn't learn in school, I was definitely learning on the job. So I ended up in primary care for about 6 months. I did that right out of school before I ended up transitioning back into oncology.
It's so interesting when you are working right out of school, one, learning on the job, and especially if you're working in a new care model or a new payment model, you get kind of this insider business knowledge too. So that must have been very informative very quickly.
Definitely. There was a different format because I came from inpatient and really outpatient from hospital organizations. So transitioning into an outpatient center was very different when it comes to like how patients are treated and what stat looks like. Whereas when I was an inpatient, it's like stat means you go downstairs, you get your stat, whatever it is, and then come back and we're there. But on the outpatient world, it's definitely not how it works. So definitely a good learning experience to kind of see the whole picture.
Absolutely. Do you have any advice for other NPs who are deciding on a first job?
I think it's really important when you're looking for a job to make sure that it is a position that's going to be supportive to a new grad. There are certain organizations that have great structure and plan and onboarding for new grads. And then there are other organizations that just really are looking for more of somebody that has that experience. And sometimes that organization may not necessarily know how much support a new grad requires. So, you, as I would say, as the new grad, my advice would be really investigating that off the bat in your interviews and really understanding what that support looks like and ensuring that they have a good onboarding and robust onboarding process and support for that transition because it is a really big transition from the RN to the NP role.
Definitely, yeah. We've heard a lot about that transition being a challenge in various ways and just a different mindset that you have to apply. And to your point, so much of the learning happens on the job. So being in a very supportive environment seems quite critical. As you think about some of the additional roles that you've taken on as your career has evolved, what factors have you prioritized and what factors do you encourage others to prioritize as well?
As you transition, I think mindset is the biggest thing, and having grace on yourself, I would say, because I think as nurses, we're really hard on ourselves and we want to be right and we want to know it all and we want to show up and be the best advocate we can for our patients. And sometimes it takes a step away or step back to really acknowledge I may not know this, but then also understanding what are my resources when I don't know. Because as a clinician, it doesn't matter how many years of experience, you will always encounter a instance where you're like, this isn't fitting the classic clinical picture, right? So we're always in a learning process and advancing our education as treatments start to also advance. We have to keep up with that. So I think having grace is one of the biggest things on yourself, and then realizing where you stand in your own skills, right? And realizing like doing a self assessment before you go into a role. So, for example, for me, I went from oncology into primary care. So I was very strong in like preventative measures and things like that. But when it came to primary care, I didn't know all of like, we'll say like rheumatology or other things that I hadn't really encountered. So I had to do a lot of studying on my own and really understanding my own resources. Okay, what resources do I have around me that I can utilize to really be successful?
Definitely, yeah, recognizing the various resources that are out there and finding the one that's the best fit for you and for your existing need. We know that one of the roles that you had was actually managing other APRNs and growing an APRN team. What was that experience like? And were you specifically seeking out a role of that nature, or did it kind of just land on your plate?
Yeah, so the organization I was in was starting to grow their APP leadership. We had an APP director, and then they were looking for managers. And I am such a change agent. I love to be a part of anything that's new that is making a change and making a difference. So I definitely sought out that opportunity, and I sat down with the director and kind of had some ideas just because although I was a newer nurse practitioner, I had been in that organization for over 10 years at that point. So I knew just from the experience there what was needed and what I felt like I could contribute to that role. So I think it was definitely one of those things that it was a learning process because not only was it a new role entirely, but I was a newer nurse practitioner. So it was really great getting to be that support for nurses and nurse practitioners, or nurse practitioners in particular, or APPs, really advanced practice providers, because I did have a couple of PAs, but mostly nurse practitioners. And I think getting to know them and really understanding their needs for support and how I could advocate for them in their roles and really help them be the most successful. That was really, really a great learning experience. And then also, what we had was we had other APP managers of different divisions and different departments. And we would kind of come together and really collaborate together to really help brainstorm what is the best way to support our APPs entirely. And then as we were growing the leadership team, we were also growing the nurse practitioner teams. So we had just acquired a fairly new hospital that needed a new NP team, right? And so onboarding them was a really neat experience. And again, getting to know them and getting to know what does that look like. Now you're new to the organization, and we got to kind of onboard those values and that kind of culture as well. So it was definitely fun and it was a great learning experience. And I learned a lot about myself just because I think kind of determining, okay, all of my career I've been a support for patients, right? But now I'm kind of transitioning this advocacy role into supporting those that care for patients, right? So it was great. Yeah.
It sounds like such a great role for someone who's clinically excellent and also a systems thinker to then move into that role where you're abstracting your understanding of care, not only for the individual patient, but then for the people who are taking care of the patients. I'm curious, you said you learned a lot about yourself. What did that process look like, or what did you uncover?
Yeah. So I think for me, it was I wanted to be there for everyone all the time. And I had to learn how to really set boundaries for myself because what happened was I had like five different hospitals at the time. As a newer manager, you want to go and develop relationships with them in person. So I found myself driving everywhere and really just in different meetings, sometimes putting out fires. And so it was definitely a challenge, but kind of understanding for me, like, okay, how can I prioritize? How can I sit back and prioritize? Like, I've got to take care of me also, but still be able to be supportive. And how can you do that? You can't be at two places at once. How can we use technology? How can we use systems to really continue to be that support and then use my brain power to really create systems that out of nowhere to really be there? So I think for me, it was boundary setting and then creating systems to make sure that everybody felt supported and that what I had envisioned for the role could actually be executed.
Absolutely. We'll get into this in a minute, but that kind of systems creation out of nothing feels so entrepreneurial. Danielle and I talk about this often, where at the end of the day, our brains are so tired. We're like, what was so hard about today? And it was that you're creating things that just didn't exist before. When you were thinking about hiring NPs or hiring APPs, did you have an overall philosophy or approach that you developed? And what qualities or attributes did you prioritize in candidates?
I think when it comes to hiring APPs, even if they're coming from a different specialty or as a new grad, everything can be taught. As a clinician, we're again always learning. So it wasn't always the do I have experience in this? It was more of like, how will the team that they're going into be able to really mesh well with this candidate? So, personality wise, openness to learning. Are they open to feedback? Making sure that they know what they don't know, that they don't come in with thinking I know it all and don't worry, you don't have to train me or anything like that. So I think the personality of somebody that is wanting growth and open to learning is really key. What I would do is set up meetings with the team themselves. And then I would kind of set those up and then I would kind of be like fly on the wall. So although I was definitely encouraging the questions, I would have the conversation really around the team to kind of see how that flowed and then follow up with the candidates to see, how they felt about it. And then also the team, like we would have like a debrief and just, what did you think about this? What did you think about when they said this? And then sometimes we would bring in other team members where they're like, you know what, we didn't have Dr. So and so or this person there today. Can we have another meeting just to make sure that everybody's on the same page? So I think the team is a big deal because when you're in a team environment, and even though you're seeing patients individually, everybody's working toward the same goal, which is excellent patient care. So making sure that everybody feels in good alignment, the person that's getting hired, it was very important to me because I might love the person, but if the team is like, they were okay, then we need to continue to find the right fit.
That makes a lot of sense and sounds very thoughtful and logical. Now that I'm thinking more about it, it does seem like that approach of team based hiring is not something that exists super commonly in healthcare, it seems, at least from the conversations that we've had. But it's so thoughtful and logical in the sense that, especially in a clinical context, so much of the work really is very team based, and how the team collaborates is so important to having good patient outcomes. So it's amazing that you were able to really incorporate the team in those decisions and give them a lot of agency as well. This feels like a natural transition to talking about the clinician life and also the nurse rep. So I'd love to hear a bit more about what inspired or motivated you to launch both of those businesses and how all of those experiences culminated in those businesses.
When I was in my role as an APP manager, I felt like, especially the new grads, really just needed more support on the professional side. I would get resumes, and I'm like, man, we're at a level where these resumes really should be highlighted in different ways. And so I would have a lot of new grads come to me. I wasn't their manager or anything, but they would just kind of cold outreach to me, knowing that I was one of the new hiring managers and they were looking for positions within the organization because they were working as nurses and then graduating as nurse practitioners. And they're like, what can I do to really set myself apart? So I would do a lot of coaching and kind of mentoring and talking about how to set yourself apart and really how to network and really the skills that were necessary that were missing that we don't get anywhere other than experience. We don't get it in school. So that was part of where I started to really love that piece of my job, right? And then also when we would have nurse practitioners that wanted to transition or wanted to go into a different role within the organization. So they had experience, but they're like, I'd like to transfer to this division. And so we're helping them work through that was my favorite because it was like the one-on-one help. And so once I had transitioned out of the APP role, I knew I wanted to do something in mentorship and helping teach these skills. And so I started the Clinician Life. We started with resumes, and then I had created portfolios from my DNP school. They made us create one for school. And I don't think anybody else really used it outside of that. But when I went looking for jobs, I revamped my portfolio and it really helped me set myself apart. So once I created the Clinician Life, I'm like, I want to teach people how to set themselves apart with this amazing tool. So I started creating resumes and portfolios for folks, and then word started getting around and people started coming and asking for more and more help. And then I also started working part-time as an endocrinology nurse practitioner. So I was starting my business and then I was working part-time clinically, and I started learning what I could do to better teach people, because what would happen is I would get on the phone with people and say the same thing over and over when it came to like helping them with interview prep. So I said, you know what? I should create a course that just has it there for them so that they can consume that on their own time. But then when our time together comes, then they can ask me specific questions about themselves. So I created digital courses, I recreated templates, just little by little, making more and more resources so that people can consume them at whatever level they're at. And then Nurse Rep, what happened is once I transitioned out of my APP role from that organization that I had been at for over 10 years at that point, they had all my credentials. And typically that's what happens with any position. They have all of your licenses, certifications, and they typically will remind you, well, I was outside of that role at that point, and what happened is that they were sending reminders for my board certification that was due to the old email, and which is my old organization email. And so I missed a deadline and I had to retake my board exam, my national board exam. And this was like in the middle of 2020, right? So we had a pandemic, we had, this transition out of this role, starting a new company. So all these other things that were kind of taking priority in my mind, and that was kind of not on the priority list. Well, it lapsed and I had to retake my boards. And I thought to myself, there's got to be a different way. I know I'm not the only one. There's got to be a different way. And so that's where the idea of Nurse Rep came along, where I'm like, okay, I can build something that doesn't exist right now to help other people. I know that us nurses have so much on our plates as advocates for our patients and our families and the whole picture of what we care for in our lives. And so I'm like, what can I make that can really provide more resources, more support to them? So that's where Nurse Rep came along, where people are able to really just house their whole professional career into one application and then kind of like set it and forget it. You're there and you're really able to just upload all your documents. Anything that needs reminders, you'll start to get reminders within 90 days. And you get text and email reminders, which is really nice. So you don't have to worry about, okay, the email doesn't work. You can change your email within the system as well. So just kind of like another support, like a backup in case these other reminders don't get to you.
With both of these businesses, you have such an additive mindset and a generous mindset, which is, I learned how to do this thing, I gained this resource, and now let me go make sure that other people who could benefit from it also have access to it. The other thing it sounds like is you are just naturally a resource for those around you, where people turn to you and turn to your expertise. So it's a really amazing skill, I think, to realize all these kind of natural resources that you have or that you've learned, and then sharing those is so generous. I wonder how it feels to start a business. Like, how have those processes for both organizations felt?
I didn't realize all that it entailed. When it comes to starting a business, you're a marketer, and I did not know that. I knew nothing about marketing. And so I think it was a whole nother learning curve. And I'm always up for learning. And so I am a lifelong learner. I love to learn, I love to take courses. I mean, I'm always up for learning. But I didn't know that's what I needed to learn, right? So the process of starting a business, not only just like the legal aspect of the LLC and things like that, but then also how do we get to the people that need us? That is definitely part of the difficulty. And then also because my mind works so quickly and I have a lot of ideas that come to mind, part of that is how do you organize all of that and actually be an integrator? And so I have the visionary part very well down. But now it's like I need to be able to also kind of shift my focus to integrate these ideas and create systems that can execute. That was a really big mind shift for me on how to do that, because again, come up with ideas all day long, but it's like, okay, well now we gotta do it.
Yeah.
Yeah.
From our vantage point, it seems like you're an amazing visionary, but also an amazing executor, and that you execute really well. But it makes sense that that's a skill that you had to acquire as well. I'm curious on the marketing piece, how did you realize that marketing was such a core skill set to have? And how did you actually go about building up that skill set?
Well, first, my sister is also a business owner. She owns a local cupcake shop in Orlando. And so she was already on her entrepreneurial journey and learning how to market. And so her and I are very close, and we would talk. I have an online business, which is very different, but she would constantly consume podcasts and books. She would be like, you know what, this is a good book for you to read. So I started with books, definitely podcasts. I've taken courses and really just understanding not only the marketing piece, but also, again, that integration piece, like how to build a course, right? I had to learn that. What technology am I going to need to be able to utilize and which one's best? Looking at the leaders in marketing and then learning from them, taking courses from them really helped to take all of that information and then utilize what was most pertinent to my business.
Definitely, there's a level of synthesis that has to come after the absorption and learning to really take those insights and convert them into something that's actionable. So it makes a lot of sense that you did this learning process and then stitching it together and integrating it into your business. What are your goals for both the clinician life and nurse rep moving forward?
So, Nurse Rep is really a product of the Clinician Life, and I really want the Clinician Life to be the ultimate resource for nurses. So, anybody wanting to go into nursing, they can get the resources they need to make those decisions, all the way to I want to retire from nursing. What is that transition going to look like? So, all transitions, all resources, I would love to have a community surrounding inside the Clinician Life, building each other up. The foundation of who I am is like sharing those resources and really just helping each other as we move up in our careers. So, having a mentorship platform, a community platform, having resources at all levels, that is really the vision for the Clinician Life. That's what I'm working towards.
I love that vision. You've already made so much progress towards that. And the idea of having a trusted source where you can go to for every career transition or question or support need, it makes a lot of sense. And there are so many touch points at which it makes sense in someone's career. We want to move back into talking a little more about the clinical component. Given your years of experience, we'd like to ask some more tactical tips that listeners can use in their own practice. First, wondering what tips you have for incorporating cultural competence when diagnosing and treating patients.
When it comes to cultural competence, we have to kind of understand and focus and look inward and see what we know and what we don't know. There are lots of programs and continuing education that you can take on things that you don't know. But again, experience is always going to be important through your learning process. So, understanding yourself and then your own biases and your own thoughts and your own understanding is the initial step. And then even asking questions of your patients, asking them how they prefer to be treated or how they prefer to be spoken to. And this goes down not even just culturally, but in general. I think when it comes to treating patients, it's all individualized. So it's shared decision making at its core. For example, me, I'm of Hispanic culture. Someone might think that I prefer Spanish speaking, but I don't because that's me individually. So talking to your patients and really understanding what their preferences are and then understanding what you do and don't know is part of cultural competence.
Yeah, it sounds like the key is really asking and listening rather than generalizing and assuming that you right approach because it certainly is very personalized and you can't guess what someone's preferences might be.
Right.
How about any tips that you have for deciding which drug class or specific medication to choose for patients that have type 2 diabetes?
It always depends on, again, their individual labs, their individual lifestyle. I just had a patient yesterday who really is almost a type 1. They have a low C peptide. We're kind of in this transition where he needs insulin, but he doesn't want it. He refuses injections. So it is really difficult when you know what medications you have, but then we again have to have this shared decision making, these hard discussions, and then we have to tailor our approach. It just depends on their lifestyle. Okay, what are they able to manage? What are they able to afford? What are they able to get access to? And then what is on my list of things within that kind of dwindles down. Okay, what else? What do I have in that bucket? And then utilizing the best that I have for that. Again, it's always about shared decision making and then really looking at the clinical picture and thinking, okay, what can I use that is going to be cost effective, but also the most effective? I always look at benefits and risks of therapy. And I talk about this all day long with my patients. I'm like, look, here are the benefits of therapy and here are the risks. Anything we give you, we're always looking to aim, I want more benefit than risk out of this. And if we're ever to a point where you're having more risk than benefit, then we need to switch it up and we need to really go into a different type of approach.
Such a helpful way to frame it for patients and that shared decision making to get everyone invested in adhering to whatever the decision is. There's only one way, and
Right.
it's everyone being on board.
Yeah.
What are your tips for managing formulary restrictions for patients with diabetes?
It is the most difficult thing. I think that is probably what raises my blood pressure the most. And I try to be patient. I really do, but it is like I have to take a deep breath because at the end of the day, I have to do like all of my prior authorizations and all of that paperwork. And I just have to take a deep breath and realize, okay, this I have to know that there is a patient at the end of this paper. You know what I mean? Like, because when we do our administrative time, it's after a full day of work, right? A full day of making decisions and all of that. And then only to learn, okay, that medication that you chose that is definitely benefit outweighs the risk is not covered. And then so you're like, okay, now what? So I think for us, I start with, okay, what is comparable? Maybe there is another brand that we could use that they're preferring. And if that's the case, I'm okay with that. Then we'll just switch to the other brand. If they're not covering that at all and they want a complete prior auth, then I'll go ahead and complete that and then talk with the patient about this is the process, this is what we're looking at, and then make a plan for next steps. If this isn't approved, then this is what my plan is. So that's the approach. It's a continuous process. I will say it's one of the most frustrating things about being a clinician is that those restrictions, but we deal with them the best we can. And I think the best way to deal with them is really just, again, having a backup plan and having those discussions with the patients.
Absolutely. This is something we hear a lot. And for clinicians who are confident that they have the right answer for their patient, have educated their patient on the thing that they're going to do, and then to reach a issue and it's administrative just feels so nonsensical because it doesn't really feel like it's for the patient. So
Right.
your approach is very sensible and it makes sense that that's a blood pressure raiser, certainly. What are your tips for utilizing continuous glucose monitoring for patients with diabetes?
So I love CGMs, and I think that they can really help a patient understand their body better. And I will say, patients with continuous glucose monitoring have better A1Cs, they have better regulation of their blood sugars. They just do. And we're limited because sometimes they're not covered for those that are not directly on insulin. I have discussions with my patients of like, if you're able to afford an out of pocket cost for it, and we talk about the cost and everything, I will typically recommend it if we're making changes to a medication. And I'll say, okay, we're going to make a change. Let's try it for a month if it's possible. Then, if we get you into a stable place where we know what you're doing and what you're eating and how it's working, we can get off of it. That's how I use it for non insulin dependent diabetics. For insulin dependent, I mean, we definitely talk about it when they come in and we look at it. We look at the numbers, we look at fasting, we look at postprandial, all of that, and really determining, okay, how are we going to adjust the insulin and how are we going to adjust the rest of your medication in addition to lifestyle, right? I always try to have these very honest conversations with patients of like, your A1C is 12%. There's no way your morning blood sugars, or when they're not on continuous glucose monitors, they're telling me their blood sugars are in the 100s to 120s in the morning. And then like after eating, no more than 150, maybe 170. And I'm like, you know, let's get sit on the CGM. Maybe we're not capturing that.
Yeah.
Yeah, that makes a lot of sense. It sounds like it's an amazing tool for having very clear data insights, and when it's covered, that's amazing. And when it's not covered, if the patient can swing it, it really does make a big difference, especially if you're making changes to the regimen. And even to give a bit of truth serum, it sounds like it's helpful for that as well.
Definitely.
Moving away from the clinical domain, you're obviously a business expert as well. So we'd love to ask you a couple questions in terms of business tips for NPs that might be considering opening up their own businesses as well. How do you suggest other clinicians get comfortable posting on social media? And what did that process look like for you?
It was definitely scary at first. I think just not knowing what to say. And I will say, taking your phone out and recording with a camera is so awkward. It feels inauthentic, like it just feels so weird. And so it started with just like tons and tons of practice and just getting on there. I hate it. Look at it. I hate it. Look at it. Delete. And but little by little, it came to a point where it's like I'm going to spend all day here just deleting videos and doing nothing, or I can just post it and keep going, keep it moving. And I think that's kind of where I got to the point where it's like, I have something to say of value. The people that it's meant for will hear it and gain the value from it. It doesn't matter how I said it. I know that the information that's behind there can really help somebody. So I think it's just kind of getting past yourself, getting past this block. As long as I think you're coming from a point of what you want to share is incorporated into what you're posting, then just hit it. You'll get better as time goes by. And I think your audience will tell you too, right? There's even now, like I'll post something and it doesn't resonate and I'll see there's really nobody engaging with it versus something that I post and it's like, okay, this is much more engaging. This is much more valuable. Then you can kind of learn, oh, I need to kind of tailor my content.
Such good advice to one, a little bit get over yourself because you have something
Yeah.
valuable to say. You are deeply speaking to us. It was really challenging for us when we were first learning too. And then two, really listening to your audience. And if they're loving something that you're posting, clearly you've struck a chord that's really valuable for those people. So that's really great advice. What tips do you have for getting inspiration for content?
Looking at people in your field and looking to see what they're posting and what's resonating with their audience. For me in particular, there's lots of nurse leaders online. So I follow them and I will kind of keep up with the trends also with what's going on in healthcare, what's going on in their communities. When it comes to looking outward, you look at people that are in your same field and then kind of tailoring the messaging on how that relates to you in particular. They might be talking about something that you have a completely different opinion about. So then you can go on and really just share your opinion and what your thoughts are on that specific issues. Yeah, I would say that's my advice, just kind of looking outward and tailoring your message to where it comes from you.
Great advice. And also a really nice and respectful way to create dialogue around areas of interest for you and for your audience and for other leaders online.
Definitely. And even engaging with them, right? Because even if you comment on their posts or follow them or even DM them and just start relationships, I've built lots of friendships online with people in the nursing field because they've either reached out to me or I've reached out to them and been like, oh, this is such a great content piece or this is such a great thought. Just being social on social actually makes a big difference.
It's easy to forget that that is a really amazing way to connect. And even if you disagree with someone, if you're doing it respectfully and you're coming from a place of genuine interest and curiosity, it's also a great way to deepen your understanding and the other person's understanding. So it can be very productive if everyone's coming with good intention.
For
Yeah.
sure.
And it's also a sweet line being social on social. Like it
Yes.
makes a lot of sense, but I think not a lot of people think about it that way.
Mhm.
To close, we'll ask you the same two questions that we ask all of our guests, one on the healthcare system and one just a closing piece of advice. So the first one is, what changes would you like to see in the American healthcare system to improve patient care?
I think less limitations for providers. I think the way that the system is going right now, it's limiting the shared decision making that is required for really good outcomes for patients. As we kind of touched on in our conversation, these limitations on formulary and really the insurance guiding what can and cannot be provided for patients. I would love to see that lifted or expanded and just make care more accessible, because I think even when there are certain medications that are quote covered, it's out of reach financially for some patients. So expanded care, and I'd love to see more nurse practitioners stepping in the gap to be leaders within policy, within our communities, because we have amazing insight into our patients. We are the patient expert from direct patient care all the way through policy. Would be amazing to have more nurses sitting at the table.
We couldn't agree more on that, just in terms of understanding the patient, quality of direct patient care. Absolutely. What's some advice that you want everyone to hear or to walk away with? And this can be clinical or non clinical.
When it comes to nursing, my philosophy is we help each other out. We should be each other's advocates. And if there's something that you've learned that you can share, put yourself out there and share it, or reach out to others and share what you know, because I think that's the only way that we can really grow and become stronger as nurses, is supporting each other so that we can lift each other up into these positions. Kind of like what I talked about before, I really would love to see more nurses sitting at the table within hospitals, in leadership everywhere, just because with each other, supporting each other there, that we'll have a better healthcare system altogether. So,
Absolutely. It's so important for nurses to have a seat at the table, and also for nurses and others in the healthcare ecosystem to bring nurses into the room and to make sure that their voice is really heard, because it is, to your point, really the closest to the voice of the patient. And nurses are, in so many different ways, on the front lines delivering really critical care.
Dr. V, thank you so much for your time and for your wisdom today. This was a great conversation and really excited for folks to get to hear your wisdom and your experiences. This was great.
Thank you.
thank you so much. Thank you so much for having me. This was great.